DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here. Thanks for joining me on DocTalk today. We're going to have a great show. Dr. Shane Terrell from Production Animal Consultation is going to be here to talk about different chute-side diagnostics that we can do to determine the lameness of cattle in your feedlot. Everything from infectious to traumatic injuries, we're going to have it for you today, so stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Well, Dr. Shane, welcome to the show.
Thank you. Well, I appreciate you having me on.
You bet. Folks, Dr. Shane Terrell, he's a DVM and a PhD, is one of the veterinarians for Production Animal Consultation, otherwise known as PAC. Great to have him on the show. Find him a time when he can get down here out of Nebraska into Kansas. And we're going to talk about the foot, basically about lamenesses and things to that nature. But your dissertation and your research, you've done a lot of work on cattle feet and different abnormalities. So can we just kind of start out by talking a little bit about the foot and some of the common things that we see?
Absolutely. And when we think about diseases of the foot or causes of lameness, we think about first infectious causes, which is probably the ones that are most common. So we have foot rot, hairy heel wart, are diseases that are problems of hygiene, muddy pens that have a bacterial component that creates an infection. Other common causes that we didn't think was as common until we started doing a little more aggressive diagnostics, looking a little more directly at some of these causes would be toe abscesses, sole abscesses, lacerations. Those are primary bruises or hemorrhages of the sole area that, if untreated initially, we can cause can lead to infections of the joint, and so we end up with our secondary infections of septic joints, which is a lot of times was misclassified as foot rot, but is actually an infection of the joint itself, in which our outcomes are quite a bit poorer.
Yeah, and didn't you say when you start to get from some of these things, if left untreated or if the animal's not cared for, can actually lead to a septic joint or wind up being that chronic?
Absolutely. So so those secondary infections or those septic joints can come from either untreated toe abscesses, sole abscesses, or foot rots primarily, but in any of those causes where we have loss of integrity of the area of the foot, so either through the skin or through the white line of the bottom of the foot, where we can introduce bacteria, any of those can eventually lead to those septic joints.
I think one thing that has been interesting from your research, which there's many things that are interesting, but we used to be of the mindset that until the calf is so lame that it can't compete with its pen mates, if it's got a little limp, we're just going to leave it. But your research shows the sooner we get on it, the better chance we have of it recovering.
Absolutely, absolutely. Our outcomes, no matter what the cause, outside of a catastrophic injury of some sort, no matter what the cause, timing and intervention is key. So if we can address those when they're early hemorrhage of that toe and get those potentially drained or treated for prevent a secondary infection, or if we can treat an infectious foot rot early in the disease process prior to infecting that joint, our outcomes are significantly better.
Yeah, so that's what we're going to talk about, folks. When we come back from break, we're going to talk about some of the things that you can do by picking that foot up, making sure you get the proper diagnosis, doing it early, great intervention, better success and treatment success for your cattle. Thanks for watching Doc Talk. More after these messages. Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Boehringer Ingelheim Vet Medica. Today, we're going to talk about colostrum. Colostrum is the first immunity that a calf receives in its life. Within the first 6 to 12 hours of life, we want that calf to get up and suckle the first milk from the mother. That first milk is what we call colostrum, which is packed with antibodies, which then help protect that calf from viruses and bacteria such as E. coli and scours, in which the calf will be exposed to on the farm. The cow is a great source of antibody because she's been living in that environment, been vaccinated for different diseases. She produces those antibodies in the colostrum. We want the calves to be able to get it in the first 6 to 12 hours. So wait to tag that calf until after that calf has had a chance to get colostrum, because it's vitally important for the calf's health, and it's the first step towards raising a healthy calf.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices. This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Shane Terrell, who's a DVM PhD, heads up research and also is a practicing veterinarian for Production Animal Consultation. He's located in Nebraska, and we are talking about lameness and about early diagnosis in the foot. And you have some tools here. Yep. that you're going to talk to us about for a little bit.
Absolutely. If we're looking at intervening for a lot of our causes, first we got to make sure that we have the tools in place so we can first properly diagnose those animals, and secondly properly treat those animals. So the first thing that we need to do is make sure that we provide an environment that's safe for both the animal and for the caregivers who are trying to diagnose those animals. So the first thing we need to do is either consider tilt tables for proper restraint of the animal. If we don't do that, what I utilize primarily is a rope and a pulley system to lift up those feet to make sure that we securely get those feet secure so we can properly diagnose those animals.
And I think a lot of people, and I can remember back to my dad and myself in practice, when you pick that foot up, have your wash bucket and a scrub brush, get that thing cleaned up so you can really see what you're dealing with.
Yep, absolutely. Clean that foot up. Once we clean that foot up, then we're going to go ahead and do some further diagnosis where some of these tools come into play. So the most important thing that we can have around is a pair of hoof testers. You've probably seen farriers possibly have these around, or your veterinarians try it for equine lameness diagnosis. But it's an important tool to identify areas of sensitivity in that foot. So when we're looking at specifically toe abscesses and sole abscesses, we'll take the hoof testers, go ahead and squeeze, and it'll be a pretty firm squeeze on that toe to try and either we'll identify a pain response where that animal's going to flinch or try and move its foot based on the pain response, or else we could find a very soft empty socket where there was an abscess that's gone ahead and either moved out through the coronary band or into the joint itself. When we're testing the sole, across the sole, we're going to take the hoof testers and we're going to go ahead and squeeze across the back at the bottom of the foot and the sole about 2/3 of the way back. Those are where we're going to primarily find most of our sole abscesses. Sole abscesses was a diagnosis we didn't think was a problem of feed yard cattle or beef cattle in general. It's very common in the dairy industry, but as we've picked up feet and pushed for further diagnosis, we've found that it's not only there present, it's fairly a common lesion. It's just misdiagnosed and underdiagnosed.
And I think that's what, a lot of this is about, is that we've just called everything a foot rot or a club foot and gone on about our business. And what your research and your diagnostic work has shown is that, man, we're missing the boat on a lot of these.
Absolutely. And that's, what we've called, again, foot rots commonly are septic joints that are secondary to some of these primary traumatic or concussive type of lesions.
So you're looking at toe abscesses, sole abscesses as being your two top non-infectious?
Yes, non-infectious types, some lacerations in addition, but those are the two most common non-infectious or traumatic type of causes.
Great. Well, we got to take a break here, but when we come back, we're going to talk about what we're going to do when we get that calf's foot picked up, some of the things that we're going to do on diagnosis and some of the tools to help treat them. You're watching DocTalk, and we're glad you joined us.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
My name is Sam Hands. I'm part of the operation here south of Garden City, Kansas, known as Triangle H. Our operation starts with an irrigated farming operation and also involves cow-calf as well as farm feedlot. So obviously the beef industry is very important to us as a marketing tool of those products grown on our irrigated farm. I feel especially privileged not only to be a part of the beef industry, but to have had the opportunity to be one of the original 6 delegates from the state of Kansas as the beef checkoff system was established back in 1986. And as I reminisce back at that times back there in the early meetings in the mid-'80s and early '90s, to me it was very humbling and gratifying to see all segments of the industry come together with a common goal, and that was to advance the sustainability of the beef industry and by way of a product that was going to bring satisfaction to our consumer.
Hi, I'm Marissa Kleistuper, and ever since I was a little girl, I have always known that I wanted to grow up and work alongside my dad. He has been my hero since I can remember, and got the opportunity to come back home and work alongside my dad on a daily basis and learn from him and watch the family operation continue to grow. And the other best part of my day is my 2 boys get to come alongside and work with us and learn from my dad as well.
But more than anything, as I look at this whole program, is what it's allowed us to do as a sustainable program in the beef industry, and has allowed us to bring future generations into the operation in order that the beef industry might be sustainable for the future. My pride and my pleasure to have my daughter and her children to be part of our company here as Triangle H. Thank you.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
When it comes to stopping horn flies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin vet caps from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Shane Terrell. We're at Kansas State University, and Dr. Terrell is a veterinarian who practices with Production Animal Consultation, and he also heads up their research as the research director. But let's talk about, let's start out with foot rot. Mm-hmm. Okay, I pick up the foot. What am I going to see with foot rot?
So foot rot, typically we're going to see symmetrical swelling. Between those two claws, we're going to see even swelling between those claws. That's going to cause those claws to go ahead and separate to some degree. When we smell that foot, we're going to have a necrotic smell. The bacteria, the name of the bacteria is Fusobacterium necrophorum, which in itself says that necrotic or really foul smell. So we'll have those. Those will be the most diagnostic. So if we see that animal with the symmetrical swelling at the chute, we don't need to necessarily lift that foot unless we see swelling above that up into the joint itself. And so that's the one instance where we can go ahead and leave that foot down, just treat it for foot rot and move on. So.
Okay. And then the other one that has not been as common until recent years is the hairy heel wart.
Yeah, and again, probably underdiagnosed and misdiagnosed as foot rot previously, but hairy heel wart's going to be a bright red lesion. Typically there's different stages, M1 through M4 stages of that, but in general it's a very painful lesion on the back part, between the claws on the back side of the heel area. It's going to be bright red in some instances. In other instances it's just going to be kind of a area that's paired out and kind of we see some ulcerations in that spot. So when we see that, we'll press the back part of the heel. We'll see it have a very profound pain response when we press in that area. Parenteral antibiotics haven't been very successful in those cases, and so our treatments are going to be more topical treatments for that diagnosis.
And so you'll use foot baths and different things of that nature.
Yeah.
And
foot baths and wraps are all means of treatment.
You bet. Well, I think that understanding these two infectious agents, hairy heel wart's pretty contagious, right?
That's somewhat debatable. We set up those conditions in a pen. It's hard to produce that disease experimentally, and so we don't really know how contagious it is, or if we just in that pen we've set up the conditions for an outbreak itself. That bacteria is present in the GI tract and in these animals, and so whether it's highly infectious or not, if we set up the conditions, the environment for that to thrive, it can pop up in a big way.
You know, pen conditions, you made mention of that, are pretty important in controlling a lot of these diseases. What are some of the more common issues in pens that you see?
So in general, mud is one, but any time where we produce a condition where those animals never have the ability for that skin to dry out, so water pooling around water tanks, if we don't have proper drainage around water tanks, we can control mud as best as we can. In some periods of the year, in some environments, it's tougher to do than others. But in general, creating an opportunity for that heel area region to dry out is necessary.
I think some of the times, when you get that skin on the hooves that's real soft, and you have the areas that could cut, the dry areas in the pen, wet and dry areas together. It seems like if the pen's totally wet or totally dry, we get along a lot better.
Absolutely.
All right, folks, we're going to take a break. When we come back, we're going to get into some hoof pairing here, and we're going to talk about those toe abscesses and sole abscesses. You're watching DocTalk. Thank you.
When it comes to stopping horn flies, cattlemen love their vet gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin vet caps from AgriLabs.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Shane Terrell. He's with Production Animal Consultation, where he's a veterinarian and also has his PhD in production animal medicine, working on lameness. And so talk to me a little bit. We hadn't got to the nippers and the knives. About what we're going to do with these toe abscesses.
Yep. So when we move into the more traumatic causes, toe abscesses, sole abscesses, you certainly consult your veterinarian on proper treatment of these or their recommendations. But in general, we need to allow for the undermined sole to be removed. And so if there's pus forming in those places, we need to get that pus drained and remove the sole that is present over top of those.
So when we toe abscesses are aggressive or wilder cattle,
yep.
aggressive cattle, poor cattle handling, rough surfaces,
yep.
will lead to all these, right?
Yep, absolutely, absolutely. So a lot of these lesions, specifically toe abscesses, will be, we'll see early in the feeding period in the feedlot, either whether they happened in the transport phase or the sale barn phase or through processing at the feed yard, but we'll typically see those in the first 3 or 4 weeks of cattle on feed. And
one of the things that you said when I heard you speak was that if you don't treat them, that abscess is going to go somewhere.
Yeah.
And where are the 3 places it can go?
In general, it can either move up into the joint and set up in the joint, and that's when we get septic joints. The second opportunity is for it to come up the hoof capsule and come out the coronary band, and so it'll come to that hoof to skin junction somewhere, and if it does, that'll lead opportunities for other secondary pathogens to come in and cause an infection. Or the third place is to go out the bottom of the foot in the white line area. Very few of them we see do that. Most of them move up somewhere, but if we don't do something with these, a lot of times will lead to septic joint.
And I heard you say one time that you have a calf that's lame and the next day it's not lame. Sometimes those things will bust and they'll feel a little bit better, but then they just go down.
It doesn't mean our outcomes are better. Yeah,
right.
Exactly.
So tell me a little bit about what we're going to use and what we're going to do.
So I use a hoof nipper. We can have 10-inch to 14-inch hoof nippers in a chute. When I lift up the feet, I like the smaller ones myself, but what our goal is to provide an opportunity for those toes to drain, those toe abscesses to drain. What I'll do is I'll make I'll nip that toe perpendicular to the ground to provide opportunity for that pus to drain forward, not down. So we don't want to cause a hole on the bottom of the foot, so we get more dirt and mud into that area. And every time that foot steps down, it's going to work like a piston and push that pus out of there. So it's going to work to our advantage there. So that's going to be important for the toe abscesses. When we move into the sole abscesses, what we'll want to do is find that, and what we're going to do is actually pare any undermined sole out, kind of like an apple, like a bad spot in an apple, and we'll just keep taking that sole out until we get to the junction of true tissue from the sole, and just remove all that undermined sole where we've had pus in before, and that'll allow a new horn to grow in over top of it and provide a place for that to drain. And if you were going to use these, make sure we have the proper sharpening equipment. This is a rubber wheel and a felt wheel. If we have dull knives, we aren't going to get anything accomplished. So make sure we invest in the $70, $80 investment to make sure these knives are effective.
Well, thanks a million for all you're doing, and thanks for bringing this awareness to our industry. Really appreciate it.
Thank you.
Great work. Folks, thanks for watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Shane Terrell. Thanks for watching DocTalk, and I'll see you down the road.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.